Hi, I'm Cheryl Stamm, outpatient nurse navigator for orthopedics. My goal today is to get you to surgery with as few questions as possible. What I usually do is talk about the timeline of events before surgery, a little bit about your hospital stay, and then a little bit about discharge. So the first appointment that you have will be your pre-admission testing appointment. When you go for pre-admission testing, they like for you to take all of your medicines with you in the bottles. The nurses are going to go over those medications with you. When you take those, also include the over-the-counter items. They'll let you know what to stop taking, what to take on the day of surgery, and what not to take on the day of surgery. You're also going to get an event tracker in the mail. In your pre-admission testing packet, this event tracker shows you important dates, but most importantly, it shows you the same things about stopping your medications, when and what to take on your day of surgery, all the things we're going to talk about here in just a second. At pre-admission testing, you also have blood work, an EKG, and a nasal swab. Now the nasal swab is checking for MRSA. The most important thing to your surgeon is it lets him know which antibiotic to use when you're in the OR. That whole appointment takes about an hour. They are going to mention to you the use of Bactroban ointment. Now, Bactroban ointment is 5 days right before surgery. It is a prescription you'll pick up from the pharmacy. You can pick that up anytime. That last 5 days, the easiest way to do that is to apply a small amount of the ointment to a Q-tip, swab just inside the right side of your nose, flip it, do the same thing to the left side of your nose. That helps kill bacteria. They're also going to mention to you the use of Hibiclens for your showers. Now, Hibiclens, those showers are the last 3 days right before surgery, and they will let you know how long to leave the soap on the skin to most effectively kill the bacteria on your skin. Then they're also just going to make sure you know the date, time, and phone number to call to check on your arrival time. All of that, once again, all packed into about an hour. That same day, you're going to go to the total joint class. You'll meet Becky Fulmer. She's the inpatient nurse navigator. She and one of the therapy team members will get together with you and whoever else is at the class. They'll give you good information on how to get ready for surgery and some of the things you need to prepare and expect as you get ready for your surgery. Now, the next thing, I know when they scheduled your surgery, they've mentioned to you you need an appointment with your family physician. When you call for that appointment, you just need to make sure that it's going to be a few days after your pre-admission testing appointment. That way your physician can look at the blood results, they can look at the EKG, then they're going to make sure that it's okay for you to have surgery, and they'll send us a letter that says it's okay for you to have the surgery. All right, so we're up to the day of surgery. Day of surgery, they're going to have you get to the hospital a couple of hours early. They do keep you busy. They get paperwork finished, IVs started, then you go to the holding area. In the holding area, they're going to make sure they've got the right patient, right doctor, right procedure. Your surgeon will come there and autograph wherever you're supposed to have that surgery. They're going to autograph that. That way you know that this is the surgery I'm going to have today. It's a big patient safety thing. Your next stop on the journey is to the OR. The surgery itself takes about an hour and a half to 2 hours. Then you go to the recovery area. Now, in recovery, the nurses are making sure breathing, blood pressure, pain okay before they send you to the unit. Now, we do have an extra pain block that they do when you're in recovery. With that pain block, you have a cluster of nerves in your thigh. They locate that cluster of nerves, and they're going to put a shot in there that's going to essentially help decrease the intensity of your pain. It cannot take away surgical pain, but it can decrease the intensity. That usually lasts for about 24 to 36 hours and helps you get a little bit further away from surgery where you feel like your pain's more manageable. After you go from the recovery room, you're going to go to the total joint unit. On the total joint unit, there are 24 nice big private rooms, and the therapy gym's right there on the same unit. That team works very well together. They take care of patients with knee and hip surgery all the time, so it's a good place to be after you've had your surgery. The nurses get you checked in. They check vital signs, look at your IV. Basically, when they've decided that it's okay for you to get up, the therapy team's going to come to your room. They are going to get you up the same day that you have your surgery. We know that early mobility helps with stiffness, helps with pain, and mobility is a huge part of recovery. So they're going to have you stand at the bedside, take a short walk, and then sit up in the chair for a little bit. Now that night, they're going to be in and out of your room a lot. They're going to check vital signs. They're going to check your IV. They're going to ask about pain. Pain using that 0 to 10 pain scale. They're going to use it over and over again to find out how best to treat that, and did that medication work for you. You are the most important part of pain control because you are the only person that can feel your pain. We encourage you to let them know when your pain first starts to go up. Much easier to get it under control and stay ahead of it if you start early. Drawbacks to pain control. If you feel like the nurses are awful busy and you don't want to bother them. If you feel like you're being a pest because they were just in your room. And then the other one is sometimes we feel like, wow, this isn't as bad as I thought it was going to be. I'm going to see how this goes. And I don't want you to do any of those. I want you to make sure you get the pain medicine in your system and stay ahead of it, especially while you're here in the hospital. Typical day on the unit. So you got through the night. Typical day between 5 and 7 in the morning, they're going to come get you up. You do get to wear street clothes, and you want to make sure that you bring something comfortable and loose, especially through the knee. You're going to have some dressings on there. There's going to be some swelling. So nice and loose through the knee. You can wear shorts if you want to. You don't have to, but as long as the pant leg is nice and full and the nurses can check that dressing as often as they need to. After that, you have breakfast. The first therapy is about 9 or 9:30 in the morning. They're always going to give you something for pain before you go to therapy. We want you to be successful when you get over there. You give it the pain medicine before you go. It's in your system, so you're going to be able to do the exercises. Now, the exercises that you're going to do in the hospital are those that are in your book. You have a binder. About halfway through that binder, there are the exercises. If you practice those now before surgery, it makes it a little easier to do that after you have had the surgery when you're in the therapy gym and even after you go home. In the therapy gym, they've also got steps, ramp, a pretend car, pretend bed, the bathroom, the shower, all the things you're going to have to do when you get home. You're going to practice there with the therapy team to make sure you'll be successful at home. Then, not everyone's joy and delight, but you are going to go with the therapist and they are going to bend and straighten your knee. This is why you're having the surgery. So you know you want to have better range of motion. You are going to have to move. You do have to bend. You do have to straighten. After your morning therapy, you'll go back to your room for lunch. Then you'll have another afternoon therapy. In the evening, they're even going to have you walk the unit with the nurses. There's going to be a certain designated number of feet that you need to walk. No more therapy that day, but totally keeping moving, help with the stiffness, help with the pain. Now, in the evening and at night, there is nothing happening automatically for your pain. You and your nurse are going to talk about how your pain is doing. They're going to ask, do you want a pain pill now? You may say yes, or you may say after my company leaves for the evening. But that relationship with your nurse is going to be real important during the evening and at night. Now, typical length of stay for the post-op knee is 2 days. So this second day after surgery, we're looking to get you home. The day starts out exactly the same. Between 5 and 7 in the morning, they come get you up and you get dressed and have breakfast, go to therapy again. Now, after that morning therapy, there's going to be a discharge class, and we really want your coach, your family member, whoever's going to be able to be with you after surgery, we'd like for them to come to one of the therapy sessions and see the exercises, plus come to the discharge class, because sometimes with pain medicine, you're going to be a little bit drowsy. We want someone else to hear that so you can compare your story later. Then you'll have lunch. You'll go for therapy in the afternoon, and our goal is discharge around 4 or 4:30 in the afternoon. Now, when you get home, you are going to continue outpatient physical therapy 3 times a week for 6 to 8 weeks. Okay. Now, You are going to need a walker. So the walker, we like wheels on the front, no wheels on the back. If you don't have one, we can help you get one when you're in the hospital, so don't fret about that. But you're going to use the walker for quite a while. As you go for outpatient physical therapy, your therapist is going to let you know when your balance and everything's good, you'll be safe, and you can switch to using a cane. So the cane you'll need, single point cane, nothing special, just the typical single point cane. You are going to go home on a blood thinner. The blood thinner that we most commonly use is called Eliquis. It's a little pill that you take twice a day for the month after surgery. Anyone who's had joint surgery, knee and hip surgery, at risk for blood clots. So this blood thinner is going to help prevent that. We're also going to have you wear compression stockings, usually for that month, 4 to 6 weeks after surgery. Nice and tight, helps keep the leg compressed so that there's less chance of blood clots. Now, the dressing that you're going to use is an Aquacell. So this is an Aquacell. It is placed over the incision. It seals around all 4 edges like a big Band-Aid, and it's going to protect the incision. It will stay on, no dressing changes needed, and you can shower. You just pat it dry after your shower. Now, we do know that this is protecting the incision, and all incisions are going to have some drainage. So in this middle protected area, you may see some darkened circles or lines. We call it shadowing, and that's okay as long as the edges remain stuck down around all 4 edges. We know that your knee is going to have swelling. We know that that's going to last for a few months. There's just no way around that. It's a small place that's been manipulated, so that post-op swelling, very, very common. And then as you begin to heal, you're going to have redness and warmth in that area. So we don't want you to be concerned about swelling, redness, and warmth within that first couple of weeks after surgery. If, however, it became an angry red and really hot to touch, then you need to let us know. So call us at the office and let us know. Anytime you're on pain medication, so you're going home with pain medication, you've had surgery, you're changing how much you're moving, there is always the risk of constipation. So we want to make sure that you've got stool softeners, Miralax, or the equivalent at home so that you can stay on top of this. Some people just getting home is plenty. Others need to keep an eye on things and do a little extra more than they would have done normally. Alrighty, so you've watched this. I'll be calling you within the next few days so that we can talk a little bit more about you personally, what your discharge plans are, all those things. So once again, I'm Cheryl Stamm. Thank you for listening.